Hello everyone. There is a myth that congenital heart disease is always serious and untreatable, but that's not true. I am Dr. Saurabh Gupta, Professor of Cardiology at AIIMS Delhi. Today, we will explore the causes, symptoms and treatment of congenital heart disease. Let's get started. The word congenital comes from the Latin word congenitus, which means from birth. Congenital heart diseases are heart problems that are present from birth. It is one of the most common and serious birth defects, affecting about 1 in 100 newborns. The severity can vary. Some cases are minor and may resolve on their own, while others are serious and need medical or surgical treatment. Sometimes it is so severe that treatment is required within the first few weeks of birth. Although congenital heart diseases can happen with other birth defects, it often occurs as an isolated heart defect.
What causes congenital heart disease?
The exact cause of congenital heart defects are not always known. They can happen due to genetic and environmental factors. Some babies inherit conditions that increase the risk. Other factors include infections, certain medications, alcohol, smoking, diabetes, and other environmental exposures during pregnancy. The risk is especially high in the first 3 months of pregnancy. Often, it is the mix of these factors.
Can we prevent congenital heart disease?
We cannot eliminate the risk of congenital heart defects, but there are ways to reduce it. Avoid alcohol and smoking during the first 3 months of pregnancy. Taking folic acid can also reduce the risk. Always consult a doctor before taking any medication during pregnancy. Getting vaccinated against German measles, also known as rubella, before pregnancy can lower the risk of these heart defects. If a woman did not get the rubella vaccine in childhood, it's important to get it before pregnancy.
Is the hole in the heart the same as congenital heart disease?
No, hole in the heart is a general term for all congenital heart defects. Congenital heart diseases include not just holes in the heart, but also abnormal connections or missing parts of the heart. Some children may have abnormal heart valves that do not function properly. In rare cases, it can also include issues with heart rhythm or cardiac function.
How would someone know if a baby has congenital heart disease?
Symptoms of congenital heart defects depend on the type of defect. Some babies may have bluish skin, nails and lips showing low oxygen levels and feeding difficulty soon after birth. Other symptoms may be less noticeable and develop over time. If a child doesn't gain weight, has shortness of breath, tires easily or cannot keep up with other kids, these could be signs of heart problem. In such cases, it is important to see a pediatrician or pediatric cardiologist for early detection of heart disease.
How is congenital heart disease diagnosed?
To avoid missing serious heart problems, it is recommended that all newborns get a pulse oximetry screening to check their oxygen levels. Beyond the neonatal period, for any clinical suspicion or low oxygen saturation on pulse oximetry, echocardiography should be done to confirm, understand and plan the treatment.
Can we not diagnose congenital heart disease before birth?
This is an important question. Major heart defects can be diagnosed while the baby is still in the mother's womb. This can be done using fetal echocardiography as early as the 4th month of pregnancy. Finding these conditions before birth helps in better planning of delivery and care for the baby after birth.
What treatments are available for congenital heart disease?
Treatment for congenital heart defects depends on the specific problem and how severe it is. Some children only need medication to manage their symptoms. Others might need more advanced treatment. Some heart defects can be fixed with catheter-based procedures without surgery. However, in most cases, surgery is needed to correct or improve the heart's structure and function.
Can children with congenital heart disease lead normal lives?
Absolutely. It depends on the type of heart defect. Not all kids, but with proper treatment, most children with congenital heart disease can live normal and fulfilling lives. They require routine checkups with a cardiologist, keeping an eye on their heart health, particularly if they have undergone surgery and other treatments. Some may need to avoid intense physical activities, but most can do everyday activity with the right care. It's also important to maintain good oral hygiene to prevent infection of the heart. So to conclude, we need to understand that modern medicine offers great treatments, and with proper care and support, children with heart defects can do well. If you notice any symptoms, consult a doctor immediately. Give importance to screening during pregnancy and for newborns. Please share this information so that others can benefit and take timely treatment. Take care of your children's health and ensure regular checkups. Thank you. Namaste.